Yeah. And I have my slide as the only one, so. Well, good afternoon, everyone, and we will get started because, as everyone knows, we are starting way behind time. And not only are we starting way behind time, but we have lost a half hour of our session. So we're going to go efficiently.
So,
We could spend a great deal of time talking about. I'm John Samet from the Colorado School of Public Health, and we're not going to do long introductions since we have no time, but those are all available, of course, our speakers. I have, which is here, which we put together for a document we've been working on research needs. This shows an incredibly idealized linear world in which you start with research and end up with something happening, action, and then you evaluate what has been done, so-called accountability. And as shown by the arrow at the bottom of this fanciful diagram, you then redo what you have done, and based on what has happened, you might do more research and lead on back through this cycle. And in fact, I think it's useful to conceptualize because there are some places more advanced in their air pollution control efforts where this has happened. It used to happen in my country. We will see what happens in the future. And I think it's also useful to think about where different countries may be in this process. Perhaps they're just at the stage of developing research. Perhaps research evidence is on hand both locally and internationally, and processes are being developed to move from evidence to action. So think about this, and along the top and the bottom are things that get done by different people. And we're sort of focused on the box where there's action, there's regulation, there's different ways to move forward, to do what needs to be done to protect public health. So let's keep this in mind, and perhaps as we go through our discussants, we can turn back to this diagram if in fact this proves to be useful. And this will eventually appear in a publication that we are putting together, the WHO team. So we'll move on quickly then to Jacqueline Alvarez for her introductory remarks.
Hello, good day to all of you. I'm from UNEP, the United Nations Environment Programme, and it's a pleasure to be with all of you, and in particular to show the real cooperation that exists with our sister UN organization, the WHO. So I'd like maybe to start with a big reflection, and the reflection is on the power of three. Those of you that like literature or read books, you will always see that there is this analogy with the power of three. So which are those three elements or areas that I'd like to maybe put forward for our thinking and following what our moderator was saying? So one is we need standards, we need guidelines, we need to know what's good and what's bad. But if we don't have frameworks that can help or allow us to really move forward to that, regulatory frameworks, legislation, is very tough. And what is the third pillar for this power of three? The third pillar refers to practices, to patterns, sustainable patterns for producing things, for using things, from selecting and choosing. So if we don't have all of those three things together, air will never be of the quality we need for many different reasons. So we have the aspect of understanding and science, maybe the first part that it was referred there. We have the aspects of indicating in which game we are playing with the legislation, and the third one, of course, is how people respond to those things. I'd maybe like to go very quickly into some of the things that as UN organization, we are trying to do. And one of the most important areas is the production of information and guidance to better understand and translate what certain things mean in the context of the different sectors. That's one. My colleague will later explain a little on the guidelines that we have and on the different, in a way, tools and instruments. And the numbers are still shocking. Even though we have known the theory for very, very long, we are still far from meeting the 100% or the close to get into the ideal situations that we need to have. Monitoring is very important, and I'm just picking that, but as far as reports and literature is talking, only 37% of the countries in the world are doing monitoring. And when I'm talking about that, I'm not even talking about big countries like, for example, Brazil, that it's very close to us, or other countries. So it is not even comprehensive in that aspect. We are also working and developing what we call a policy tracker to understand better what's happening around, what are the lessons learned that we have, and how to maybe locate all of those financial resources, priority setting, and ways to do things. What do we aim? We aim to have one atmosphere that we can all breathe in, as we have been hearing very strongly, but we will never get into it unless we have collective actions. So please think about this power of three conjunction and the need of those things that we have known for long, but maybe not yet being able to apply strongly. Thank you.
Thank you. And now we will move on to our second speaker, Meltem Cutler-Jos from the Swiss Tropical and Public Health Institute.
Thank you. Thank you very much for the introduction, and thank you, WHO, for having me. I want to give just a very quick overview. So this is the health session on air quality standards and legislation. And this is a quick recap on why we are doing this. You have heard this a lot in the last couple of days. So we have heard that there are manifold health effects of air pollution. There is tremendous evidence for it, and it's not only the lungs where everything starts, it's the whole body that is affected. And all ages are affected by air pollution, and the impacts are tremendous. So this is just another way of showing the known health effects of ambient air pollution. That's something we put together in our project at the Swiss Tropical and Public Health Institute. It's an interactive figure on the health effects of ambient air pollution. It's based on the US EPA integrated science assessment, where they have decided what is a causal effect or likely causal effect. That's what you can explore there, and you can also have this figure in I think it's now 6 or 7 different languages. Spanish is still missing. We will hopefully work on that. So here's the QR code for you. Then, of course, the health effects we see in research, they have been now translated into air quality guideline values. In 2021, these were updated by the WHO. So on the far side, you see the air quality guideline values that are in place now, and there are 4 different interim targets to help the countries to get into the right direction to lower air pollution and to increase air quality in their countries. And we have worked in 2017, we have done a survey on which countries have air quality guideline values and at what level. And we have now, with WHO, updated this work. And with this QR code, you come to the WHO website where you can explore not the latest version yet, it's the version 2.1, but it will soon be updated. We have asked WHO member states, we have researched the websites of administrative from offices, and we tried to gather the information on air quality standards worldwide. So what we see here is that none of the countries nowadays comply with the 2021 air quality guideline values, but we have found that 50% more countries have now air quality standards for PM 2.5. And we have also seen that 12 countries that had air quality standards for PM 2.5 in 2017 have even set more stringent standards. So there is a development, and that's a good story. This is just another example for PM10. So there are more countries with values air quality guideline, air quality standards for PM10 than for PM 2.5. We have found that 27% more countries have now PM10 standards, and 11 countries have more stringent standards than in 2017. If you find any faults or mistakes in these numbers for your countries, please do not hesitate to get back to us. I have put the email addresses here. And I think, no, this is also slide that Maria Neira was showing on the first day, showing from the regions how many countries or which percentage of countries have set air quality standards. And there's Europe with 79% of countries with air quality standards, and yeah, some lower than 50% of countries for other regions. So there's still air up there for improvement, but I think the process is going in the right direction. And with that, I end my short introduction to air quality standards. Thank you.
Thank you, and for that quick review. And we'll now turn to Renee Gift from UNEP to present on effective legislation, a cornerstone for air quality management.
Thank you very much. Good afternoon, everyone. My name is Renee Gift. I'm from the UNEP Law Division, and I wanted to talk today about air quality legislation. So why focus on air quality legislation? Why are we suggesting that legislation is an effective way of managing air quality? Well, there are a number of reasons, and I'll touch on some of them. But first, to say that legislation in this case refers to laws and regulations made under legislative authority. So any binding law or regulation made under a formal state-sponsored legislative process. And when we talk about air quality legislation, specifically, we are referring to legislation relating to air quality standards and their implementation. So legislative processes embed mechanisms for reviewing air quality standards and plans. They allow for the review and update of regulatory arrangements, including standards, as knowledge evolves. And they also enable legitimate political deliberation in balancing socioeconomic priorities to set and deliver air quality standards. Legislation also enables the creation of administrative structures to support and entrench implementation of air quality standards, including monitoring requirements and enforcement mechanisms. Legislation is important symbolically in projecting an authoritative vision on air quality issues. And air quality and domestic legislation has been seen as a key institutional tool in implementing the WHO air quality guidelines at the national level. So in 2021, UNEP undertook an assessment of 194 laws and regulations on air quality, as well as the European Union legislation against a model of robust air quality governance, which I will explain shortly. The focus was on air quality standards as the centerpiece of air quality law and governance. In many countries, this represents the benchmark for protecting public health from diffuse pollution. There were many insights that came out of that research, but just to mention a couple, and one was that there was a high level of heterogeneity, mainly because there's no single template for implementing ambient air quality standards in national law. There's no global international agreement on how air quality should be managed. And what was interesting was that what we found was that even when contained in legislative instruments in some countries, ambient air quality standards are not set at stringent enough levels and or were unsupported by robust administrative systems, which risk them being used as tools for legally protecting air pollution, particularly in fossil fuel economies. So what do we mean by a robust system of air quality governance? There are a few things, and a robust system of air quality governance includes one which develops air quality standards in light of public health objectives, one which determines institutional responsibility for those standards, monitors compliance with air quality standards, sets consequences for failure to meet them, supports the implementation of air quality standards with appropriate and coordinated air quality plans, regulatory measures, and administrative capacity, and includes mechanisms to ensure transparency and public participation. So these are really the criteria on which air quality legislation in 194 countries in the EU were assessed. And out of this, some insights on what is necessary for creating governance systems that are effective. And just first to mention that there are a number of different considerations that are important when considering how to develop legislation in countries. There is the nature of the legal system, as this has diverse influences, including how legal obligations are interpreted and so on. The Constitution, as we know, some air quality laws explicitly draw on constitutional guarantees to enhance air quality provisions. Air quality emissions sources and who or what is affected, relevant case law, and of course, cost and capacity constraints. These are some key considerations in integrating some of these criteria into air quality governance systems. So I'm just going to touch on some of the key considerations for lawmakers in developing air quality legislation at the national level. And first, the global context for national air quality standards has to be considered. There's no global treaty setting out general obligations relating to air quality standards or governance. There are some regional treaties which, according to assessment, have been shown in those countries or in regions where there is a regional treaty, there has been a higher incidence of national air quality legislation, and those tend to limit emissions on pollution. In international law, there is a customary rule of no harm, which imposes a duty on all states to prevent, reduce, and control the risk of environmental harm to other states and areas beyond the limits of national jurisdiction, something to be considered by countries when developing air quality law. And because there is no authoritative international treaty for establishing air quality standards, the WHO air quality guidelines provide an evidence-informed tool for legislation and policy. Below which it's unexpected that any public health enhancements are likely. And so the WHO guidelines obviously represent an international benchmark. So what are some of the foundations of developing national air quality laws? Well, first, the purpose of the law, it seems sort of it seems something that can easily be overlooked, but the purpose of the objective of the law informs its ambition and the focus of regulatory attention. Legislative regimes for air quality should pursue the purpose of achieving clean air for public health as a primary objective, and should align with national and international public health goals, such as the WHO air quality guidelines. An air quality law should promote aspects of air quality and not focus only on controlling emissions of pollution, consistent with the objective of promoting good public health. Air quality governance frameworks should ensure that there's public participation. So some air quality frameworks might prescribe public participation processes in the adoption of ambient air quality standards, open to stakeholders and to meaningful public participation. And of course, which pollutants should be included. To ascertain this, and which pollutants should come within the scope of a national law, each country needs to assess its chemical climate and produce ambient air quality standards for these pollutants of greatest significance. Regular review processes for legislative ambient air quality standards, supported by adequate data and stakeholder input, should be designed into legislative schemes to ensure they support ambitious public health objectives. Monitoring is one of the key criteria for establishing effective governance systems. Organizing air quality monitoring involves political choices on siting requirements, financial resources and human needs, areas that need to be covered, and even how to interpret the results. Legislative frameworks play an important role in making these choices transparent and consistent with the overall achievement of ambient air quality standards. Setting a monitoring requirement in law ensures that this critical element is embedded within air quality regimes, ensuring that the rigor of monitoring undertaken and the accountability of those who undertake this task are provided for. Usually, this legal requirement is imposed on the state, since air quality measurements by individual operators are not likely to be representative. Which level of government is responsible for air quality monitoring and how this obligation links to obligations to collate and disseminate data and to achieve ambient air quality standards or improve air quality is also a reason why it should be embedded in law. And then the quality of data used to assess compliance with ambient air quality standards is crucial for air quality regimes to operate effectively. Measurements should be open to scrutiny and deliver data that show transparency, whether predefined data quality standards are being met. Another important area of effective governance, compliance and enforcement. Air quality laws should establish legal mechanisms for enforcement. That is, who can enforce the law and who can enforce this legal obligation and with what procedure or sanction. Even the best legal enforcement mechanism will be fruitless with no institutional support behind it. If reliable data demonstrates that ambient air quality standards are not being met, there should be legal consequences for this breach of the law. The exact nature and form of the consequences should be defined within legislation. That means they will require an administrative process to set in motion for detailed actions to be developed or taken with respect to the achievement of ambient air quality standards. And this can be a useful regulatory device for promoting transparency. A binding legislative obligation on the state to achieve ambient air quality standards is the strongest form of legal accountability for achieving those standards. Procedural rights for ambient air quality is another critical feature of air quality governance frameworks. Air quality standards should be publicly and readily available, published in any official gazette or journal, and be accessible for free. And this, in the global assessment of air quality legislation, it was found that in some countries, although legislation existed, some of them were not publicly accessible. The public could not access information about what the air quality standards were. There should be an obligation within the law to disseminate monitoring results, both passively, for example, on a website, and actively on demand, and on a sufficiently regular basis to allow the public to be aware of immediate risks to health. A law should also include rights for the public, including marginalized groups, to participate in air quality management planning. And then the law should enable it should give sufficient standing or the right to bring actions or appear in court to direct victims of pollution, but also to potential guardians of air quality, such as NGOs, to access redress or pursue actions or inaction. Coordinating air quality governance is also an important feature of legislation. Other approaches to regulating air quality should be coordinated within air quality regimes to ensure mutually supporting implementation and to maximize administrative efficiencies. So policy and regulatory alignment across policy areas such as environment, urban planning, transport, the treasury, and so on, education, is critical to achieving ambient air quality standards in practice. Legislative provisions can require or construct coordination of government policymaking or regulatory authority. It's important to ensure that the level of government with the power to direct and coordinate policy areas implicated by ambient air quality standards is given the corresponding legal authority. So all of these criteria that we looked at today have come out of the global assessment in ambient air quality legislation and been collected to develop a guide on ambient air quality legislation for lawmakers. So this guide aims to support countries in developing legislation by outlining key criteria that they should consider. Importantly, what this does not do is provide a model law. It doesn't address the specific design of legislation, but gives lawmakers a concrete guide in terms of understanding what they should consider to be effective. And also just to say that UNEP's work on ambient air quality legislation is promoted under the Montevideo Environmental Law Program, which is an intergovernmental program on promoting environmental rule of law. We offer to countries the opportunity to request technical assistance in developing legislation on environment, including on air quality, through the Law and Environment Assistance Platform, which is available at this address or via the QR code. Thank you very much. And also, if you want to download the guide on ambient air quality legislation, it's available at this QR code. Thank you.
Thank you for that comprehensive overview. And now we'll move on to our panel. So if our panel members could come up to take their seats. Hoping panel members are here. Javi? Hello, hi. John, hi. Well, welcome. And we've gone from 6 to 3, which means that our time crunch is not as bad as it was. So we can start with that. We are supposed to end in roughly a half hour. I think we can probably go a little bit longer, but the next session is starting a quarter of the hour in our new schedule. So I know you each have some questions that you've been asked to address, and I think with a relatively small group, we should have time for some discussion and interaction, so we can look forward to that. So, Nguyen, shall we start with you, please? And your issue, I won't go ahead, is talking about experience in developing air quality standards with the health sector involved, and how can we harmonize air quality standards across regions? Is there a role for transboundary agreements? And I think really emphasis on the health sector and sort of what you were charged with. And you can really talk about whatever you want, so that's okay. So.
Thank you. Good afternoon, everyone. I think first we need to commit to cost and benefit sharing. Adopting uniform national ambient air quality standards should involve a clear framework for distributing costs and benefits among stakeholders. Second, ensure the capacity alignment. The capacity of each country's stakeholders to implement air quality standards should be at a comparable level. Third, strengthen regional cooperation. Whenever possible, regional collaboration should be enhanced to ensure the effective air quality management. Fourth, facilitate data and knowledge sharing, collaborative research, policy exchanges, and data sharing initiatives with neighboring countries can help improve Vietnam's air quality management strategies. Thank you.
Okay, thank you. And I guess we'll now move on to Zell. And with the task of talking about experiences in updating and developing air quality standards, legislation, political will, and whatever else.
Okay, thank you again for having me and inviting Trinidad and Tobago to present on their perspective. For us, we have been somewhat fortunate to have some support from our government in terms of the initiatives that we have been undertaking to implement with respect to air quality. What we have tried to do moving forward as we prepare to amend our legislation, we had made commitments to actually amend the standards for some of the parameters that are included to be more aligned with the WHO standards in the air quality guidelines. So through partnerships with the Ministry of Health and PAHO, we've incorporated a health assessment to help support some of the proposed amendments. So we would have conducted a health impact assessment to actually support what we want to do in terms of the reductions we want to achieve, looking at preventable deaths if we actually reduce the standard from current levels to the levels we're proposing. And we found that in terms of the assessment, we can avoid over 600 deaths if we do reduce to the air quality guideline, which is for PM 2.5, which is 5 micrograms per meter cubed. And we also found that if we did it for interim target 4, which is 10 micrograms per meter cube, we would avoid approximately 200 deaths. So the information that came out of that health impact assessment is key for us now in actually using to support the amendment of this standard. It's key for us to actually support the amendment of these standards. And for us, we use that as the tools and what we would call weapons in our arsenal to take whatever measures, whatever actions we want to pursue to our government. So definitely having the evidence, that evidence-based approach for the kinds of actions you want to take is important when we want to effect policy and legislative changes.
Okay, thank you very much. And I think we'll now move back to Javi Lopez, Vice President of the European Parliament to discuss experience in updating the EU air quality directives, legislation, the need for political will, and again, whatever else.
Okay, thank you very much. It's a pleasure to explain the results of the new European directive. First of all, I want to share with you that the EU has been dealing with the quality air since the 80s. We had during 45 years legislation that was being able to improve the air quality. We were completely aware that we had a lot to do, and for this reason we have a new instrument, but like the positive development and also the acknowledge dealing with this, it was in the European institution. What we made this? Because our standards had 15, 20 years, and obviously after the World Health Organization launched the new guidelines about clean air, it was the point 3-4 years ago to move on and to establish a new standards, a new legislation. What we are doing with this new legislation? First of all, to establish new standards that basically it's all the pollutants half of the current legislation to 2030. Half the available pollution in Europe for 2030. Secondly, a review of the standards every 5 years, and with the commitment, the goal that the horizon has to be the World Health Organization guidelines. But not only standards, also monitoring is a big piece of the new legislation, because we know that we had holes on monitoring, problems on monitoring, and then we established like more technical and detailed monitoring for all the member states, the establishment of new super sites that it will be like a special monitoring for all the kind of pollutants that we have the acknowledge that we have to deal with. Third, we introduce access to justice. Well, it was a big battle with the member states because obviously the national governments didn't want to establish access to justice, but opened the door to have legal cases in the courts against public administration and with their responsibility about the quality air. Like it's softer than what we wanted, but it's there. And after you have to find a brave like judge, but you have the open door now. Fourth, like public information. We were completely sure that more public information raises the awareness. If you are raising the awareness, you are raising also the push to the administrations to move in the right direction. And there are more detailed public information that all the administrations and all administrations and member states, they have to focus on. This is like the big elements of the new legislation. But I will want to end with two things fast. First, it's not only the standards, because basically all the states, the member states, they wanted to say, okay, this is the new standards, but we want flexibilities. No? We need flexibilities because we have different realities and so on, and then we have to adapt, and we need more time, and well. And then, well, the landing zone in the negotiation, it was, okay, we can work on to have more time, but only if this is not more extra time, if this is a journey that we are doing together. And then we established that all the administrations, they have to do air quality roadmaps before 2030. And to say, okay, how we will arrive to these newer standards, okay? And you can have flexibility only if you have a plan to move on and you are moving in the right direction. To don't have a new standard and say, okay, you are not in line with the new standard, or move it and then have the problem 5 years later or 10 years later, because this makes no sense. And then we establish, okay, we will do it with the regional, the local, and the member states. And my last point is, okay, who is dealing politically, to be honest, with a lot of like more difficult decisions on this field? It's like local governments and regional governments. Or in the case of Europe, if you have a standard, European standards, it's these institutions who are dealing more with that. And what we wanted to do is like we have the subsidiary principle in Europe is like you have a general goal, but who has to decide how to do it? It's the local or regional or member state. But to have the political cover to saying in the directive that it's not only these standards, like we know a set of policies that are working on this to achieve better air quality. We know it, public transport, cycling, more pedestrians, protect pedestrians to have less cars, to have electrification of the cars, to have low zone emissions, and a long list of policies that are working. Why? To have the political cover to all the measures that are being brave and are moving the cities in the right direction, saying, okay, it's because I want, because also it's the European Union who is saying this is the right path to go.
Thank you. And now we'll move to Emma Budd from Client Earth.
Thank you so much.
Do you need slides? Or?
No, have no slides. Hello. I am also coming from Europe, but more from the side of civil society. And I was going to talk to you a little bit about how the public can become more engaged in enforcing air quality standards and how we can advocate for stronger air quality legislation. The first thing to say is that the public, and it's both the public and political decision makers sometimes who could be more engaged in air quality standards. But we find that when we really speak to the public, actually they are interested. They are interested in air quality, as you've been hearing throughout this conference. It's about people's health, it's about people's lives, it's about people's loved ones. So the question is, how can they be empowered? And one of the ways in which they can be empowered is through legal tools. We heard from the UN Special Rapporteur on the first day that there are two sides to the right to a healthy environment. And one are the substantive rights, so concretely air quality standards, the standards for clean air. And the other side are procedural rights, so access to justice, access to information, public participation rights. And in Europe, in the European region, and in Central Asia, these were the access to justice, all of these in environmental matters were safeguarded by the Aarhus Convention, until recently, only by the Aarhus Convention, which has 47 signatories, including European member states, which did lead actually to some cases going before the courts, even in air quality matters. And actually the European Commission, in a report in 2019, confirmed that this has helped to, so enforcement action by civil society actors in front of national courts had resulted in actionable rulings proven to be important to accelerate downward trends for air pollution. So in other words, these kinds of actions, so access to justice, not only safeguard the human rights of the public, of citizens, but also lead to improvements in air quality. Unfortunately, particularly in the EU, we still saw some, that these rights were not always respected. And so it's been really positive to see the European Union going one step further and enshrining access to justice right concretely in the new Ambient Air Quality Directive. And so that's been a really positive step that we've seen in the European Union. And as I say, this not just safeguards, this doesn't just safeguard the human rights of European inhabitants, but also will hopefully help to further the aim of improving air quality. In terms of advocating for stronger air quality legislation, we'll hear again the law can really help us. In the litigations that we have seen in the EU in the past decade or so under the previous directive, we've seen the courts really clarify aspects of the law, of the previous law, which maybe were a bit vaguer, were less clear. And the case law which has been generated by the European Court of Justice and by domestic courts has helped to clarify and provide lessons learned under the previous directive. And the result of this, again, has been that we've seen these lessons learned integrated into the new Ambient Air Quality Directive. So then the result is not just a stronger legal framework, but also one which hopefully helps authorities to comply with the new air quality standards, and there again furthers the goal of achieving clean air by helping really with the implementation of the law. So kind of to sum up, improving access to justice rights can help not just safeguard the rights of the human rights of citizens, not just improve air quality by helping to reduce air pollution, but also can provide clarity which can concretely help to develop better laws in the future.
Thanks to all, and we actually have a good deal of time for discussion, so we will get to perhaps some questions from the audience here. I'll throw out a few things. I'll just comment from the U.S. perspective. I've been involved probably 30 years roughly in the setting of the National Ambient Air Quality Standards and chaired our Clean Air Scientific Advisory Committee for 4 years, more than 10 years ago. Public comment in that process is not exactly the public. And comment because it becomes, at least at the sessions where the standards are reviewed and discussed, very often there are a series of industry representatives of one sort or another who are there, and often the NGO community, civil society, is represented. The standards are put out for review, but how to engage more deeply with the public, it remains a challenge. And I wonder, from your experience, any of you do want to comment further about how, is there a possibility of getting really grassroots, I guess, to get input? Please, Giselle.
I think we have to take the message to them. We do have, as part of our legislative process, and for me, with the environmental regulator, our legislation has a public engagement aspect inbuilt into the legislation. So whether we want to do it or not, we must do it. But what we have noted as well, if we want to get it to the people that need to get it, we also have to have a more aggressive public engagement type program. So we've started over the last 4 to 5 years. I guess COVID probably kind of spurred things in that direction. We've started having targeted stakeholder engagement sessions on different aspects of our legislation, different aspects of the requirements under the legislation. And we also, as part of the development process, we do post the document for public comment. So it's not just a meeting where you come and only the persons at the meeting attend and we get those comments. It is in the public domain for a period of time, up to 40 days. It's advertised. We remind persons that it's available for them to go either on the website or there. For those who don't have digital access, we place it at various locations around the country so that you can go in, you can review. The actual proposed action is explained so that you will know exactly what it is we are proposing, how it may impact on you, what are the impacts, everything is outlined, and then they can provide their comments directly to us. So when we get comments, we go through them, and we get quite a few from the public when we do post proposed amendments or even new legislation for public comment. We get quite a few comments. Some may be specific to what we're doing, some may be general based on, you know, the usual, I'm being affected in this way. Yeah. But we have found that that has, you know, more or less worked for us. I mean, of course, all the things can be improved a little bit more, but you know, having that targeted approach, and sometimes we will, you know, have those meetings in between to supplement that process. But we found, you know, you have to keep repeating the messages and keep engaging in order for the public to become more aware and more involved. And we've been doing as well environmental literacy surveys locally to kind of measure, you know, how the public's understanding and knowledge of the environment is improving as we go along. And I think we have one that is due soon for us to implement again. So we can measure the progress from the last couple of times that we've done the survey to see if what we're doing is having an impact.
Great, thank you. And hand your mic to the right.
Honestly, my answer will be focus on public health. Like, focus everything in public health on arguments. I know that there are a lot of arguments on air quality, but public health now maybe 3 years ago it was different, but now it's much better than climate change. And it's a pity, I know, like climate change is the most important like threat for the humanity, eh? Like I completely know, but to mobilize like political will and to have social support, in my view, like the best argument, it's public health. It's better than budgets, public budgets, it's better than inequalities that I firmly believe, like I mean politics for fight against inequalities, but it's more politicized, like it's public health, because like for citizens, it's difficult to understand, okay, if I go to a doctor and he or she told me, okay, you have to do this, you have to do it. But a politician or a lawmaker, like if the doctors they are saying you should do that, why not? Like it's an argument difficult to beat. I really think on that. And if we want to have political will and like push on this direction, focus everything on health.
Great, thanks. Pass to Lynn. Oh, you have, okay.
Yes, in Vietnam, we have to inform the public about the legislation development and revision for the whole process, from the proposal to the final draft. And when we get the comment from the public, we have to study and to provide the public about the answer through the mass media, through the website, and even through the meeting. Sometimes the legislation should go through the National Assembly, and National Assembly is a representative of the Vietnamese people, and they raise the voice from the people, and we have to answer. And then he mentioned about the public health, and I think to foster the political win, we need to give reliable and enough scientific evidences on the health impacts of air pollution and even the economic loss due to air pollution. That's very important. In Vietnam, we have several researches on the impact of air pollution, and the scientific evidence shows that air pollution in Vietnam is linked to an increase in respiratory diseases, COPD, ischemic heart disease, and skin condition, or the number of healthy life years lost due to PM 2.5 pollution range from about 1.9 to 5 to 7 years, or annual economic loss due to air pollution estimated at 10.8 to 13.3 billion US dollars. And those data was made available to the people and really get impressed and attraction from the people, and then the people voice to the Ministry of Agriculture and Environment during the development of air quality standard was very important.
Great.
Yeah.
Good, thank you. And Emma, before we move to see if there's any very quick questions, do you have any comments, Emma, you would like to add to the top? No? If we have a question or two, we could accommodate you. Yes, just speak loudly, or else here comes the microphone.
A question about EU standards. Is the EU considering indoor air quality standards? Mandated standard.
It was in the discussions in the Parliament, this possibility, when we are not doing binding legislation, but who has the right and the option to initiate legislation in Europe is the European Commission, not the European Parliament. And the European Commission has not plans to have indoor standards. But this appears in our resolution and in our discussion, and it's easier in the European Parliament to fight, well, at least in the past, it was easier to find will on this, and we will see in the future, but for these next 5 years, I think we will focus on the implementation of the standards of 2030.
Great. Yes.
Hi, my name's Suzanne from the McCabe Center for Law and Cancer, and I had a question for Renee, actually, and I was curious if UNEP also provides assistance to countries to enforce their existing laws.
Thank you for the question. I wasn't sure what you meant by enforce. We provide support to countries in implementing the legislation or strengthening it. So in terms of enforcement, I'm thinking of supporting countries to identify challenges, maybe in institutional capacity or the legal framework that might undermine enforcement initiatives. But I don't know if this is what you mean, but we support any activity that could promote or strengthen environmental rule of law. So this might be from helping to develop legislation, to understand how to implement it better, or it could be providing capacity building to countries, to lawmakers, to legal professionals in understanding the law, understanding implementation challenges. This is the kind of support that we provide.
Okay, thank you. And we might have time for one last question. In the back? Oh, wait, in the front and back. Sorry.
Hi, my name is Daniela. I'm from the Inter-American Association for Environmental Defense. And I would like to ask to the panel, what do you think is the role of civil society in the enforcement of this kind of legislation?
Emma?
Thank you. Well, I think civil society can be very important to enforce this kind of legislation. I think that often we're keeping track of how the law is being implemented and how it's being enforced. Lawmakers, if we're taking them in good faith, have many different priorities. And so I think as civil society, we can really be there to watch and to kind of monitor to make sure if it's being, as we said, properly implemented, properly enforced. But of course, again, that relies on being given proper standing and proper access to justice rights in the air quality legislation. So I would say this, but I think our role is very important as civil society, but it's really important as the underlying message to make sure that the basic rights of access to justice, access to public participation, access to information and public participation rights are granted as a basic point.
Great. Well, good. Well, sadly, we are out of time. And I want to thank the speakers and the panelists. I think we covered a lot of ground. And clearly, we have a lot more we could cover. Thank you.